Welcome to the Medical Staff Voice Live. I'm Dr. Stan Froswhite, Chief Medical Officer at Community Memorial Health System. And I'm joined today by Kathryn Harada, RN, BSN, and our Orthopedic Patient Coordinator. Welcome, Kathryn.
Thank you. Thank you for having me here. It's a pleasure.
It's our pleasure. This is a great opportunity for our medical staff and community to learn more about the Total Joint Replacement Program. Tell us how the program began, please.
The program actually began a little time before I came aboard, but picking it back up in April, now that we're kind of heading in a better direction with COVID, we're able to restart our inpatient patient education classes for our total joint replacement patients. So really it's kind of rolling out that red carpet for our elective total joint replacement patients.
Thank you. Mm-hmm. So this is patients that come to Community Memorial Health System for their care.
Yes.
Excellent.
Yes.
And does it involve Ojai as well as Community Memorial Hospital?
Absolutely.
Very nice.
We incorporate our total joint program in the Ojai Valley as well as here in Ventura County.
That's impressive. Mm-hmm. That's wonderful. What is your role in the program? What do you specifically do in order to facilitate this program's success?
My role in the program is to really be a facilitator, a tour leader, if you will, for our patients who are coming here for their joint replacement. I meet with them before their surgery date. We have a patient education class. We go over everything they need to know to be ready to have their surgery. I see them throughout the process, the day of surgery, post-operatively. If they are inpatient, I round on them after surgery. If they go home same day, wonderful. I contact them at home to make sure that they're safe and set up at home with everything they need. So it's kind of an amazing process that I get to see them through their surgical journey here with us.
So that's also really wonderful for their comfort in the continuity that you provide with a familiar face to them.
Yes, I am that familiar face that greets them. I tease them because in the sense of when they go back for surgery and they wake up in recovery, I let them know I'll be right there with them every step of the way.
How comforting for them. That's wonderful. Mm-hmm. And what are the basic goals of the program itself?
The goals of the program are to ensure that our patients have the best outcomes. We want to ensure that they have everything that they need to be successful, to get back to doing what they enjoy doing. So we want to help them to feel better, to be able to go home safely and get back to living their life.
Well, you know, that's really interesting to me because I've learned a lot just speaking to you even now and prior. And the goals that you describe, how do we achieve those goals? What are the changes we've instituted? I know we've made hospital stays shorter, some same-day discharges.
Absolutely.
Those are amazing achievements that at one time were thought impossible. I remember when I was a young training physician, it would be common for people to be in the hospital for a week after a joint replacement.
Yes,
and
absolutely.
Now they can go home the same day. What is it that we do differently?
Well, we've really taken a look at how we're able to ensure that clinical variation is reduced. We want to increase our patient satisfaction. There is a huge part of our rehab that is incorporated with that. So even patients who are discharged same day, we're still having our rehab team come in and evaluate our patients, both occupational therapy, physical therapy, to ensure that they're safe to be discharged home. From there, patients, if they are discharged home the same day, we ensure that they have home health services set up to help them navigate their home and ensure that they're getting up. We want to help prevent DVTs once they're home, pneumonia. So we really have a lot of opportunity, not only to educate patients, but to see that they have the best experience here with us.
So again, success in the basic concept of continuity, just as you are a continuity for them, the continuity in occupational and physical therapy as well.
Absolutely. So it doesn't stop once they leave our facility. It continues on in their home. And then additionally, they transition to outpatient therapy programs.
I was absolutely fascinated by something we had spoken about, and that was a dramatic change in the way we think of NPO, or nothing by mouth after midnight. Could you explain that a little bit?
Absolutely. We've incorporated what's called enhanced recovery after surgery, or ERAS. And it incorporates patient optimization before they have their surgery, as well as improved healing after surgery. And one of the ways we do that is that we provide a pre-surgery nutritional supplement for these patients. On the day of surgery, instead of the old, nothing by mouth, as you mentioned, after midnight, our total joint patients are able to drink this shake that we provide them at patient education 3 hours before their surgery. It promotes gastric emptying, it helps level out blood sugars, and also helps prevent post-operative nausea and vomiting. So it's really a huge patient satisfier in addition to helping post-operative recovery.
Wow, so what was gospel once is now changed into new gospel, is that right?
Yes, exactly. We're moving in a new direction, and it's all beneficial for the patients. The great thing is, we discuss this, we've worked in collaboration with our anesthesia providers. They are on board with it. Our total joint replacement surgeons are also on board with it.
Wow.
And it's not unique to this service line. There are other service lines here within the hospital that are also moving forward with ERAS protocols. So
hard to argue with success, huh?
it is.
Well, that's great what we've learned. As I said, so much has changed from my early training. It's really quite impressive.
Yes.
It's nice to hear that the nutrition that they receive prior to surgery actually helps them through surgery.
Absolutely, yes.
Who is welcomed and invited to participate in this program?
Well, when I tell you it takes a village, I'm not kidding. There are a number of individuals that are here to serve our patient population, that serve the community. We want to make sure that they have the best clinical outcomes. So that starts with the patients. Our patients are the biggest part of this program. The main part of the program, if you will, are orthopedic surgeons. They're a part of this program. And we continue down the line and we say our rehab staff, our occupational, our physical therapists, they're part of it, case management, all of the nursing and perioperative staff, as well as the acute care staff on the nursing units. So it is a full team of individuals that are there for our patients.
And in order to achieve this, it seems obvious that you and others must have participated in an enormous amount of education for all those participants, physicians, patients, clinical staff,
Yes.
All staff.
Absolutely. And there's absolutely an opportunity for certifications within orthopedic nursing that we're working with our nursing education staff to obtain those, not only for our perioperative nurses, but also for our acute care nurses.
Sounds like you feel pretty good about the progress we've made on such a relatively youthful program.
Absolutely. I'm so excited to see where this will continue to grow and support our community and our patients in the community who deserve the best outcomes.
And I understand we've had partnership inclusion in all our orthopedic partners from all the various organizations that operate here at Community Hospital.
Absolutely. When we look at the clinical pathway for our total joint patients, all of our orthopedic surgeons are in alignment with that. And it's wonderful to see everyone coming together for our patients to have that great experience. Getting that feedback from them. I do a post-op phone call as well once they're home, and to share that feedback with our teams, it really is rewarding.
Well, I have to admit, I remain impressed with all participants. Our medical staff is probably the most collaborative and communicative medical staff I've ever seen or heard of. So I'm so glad to hear we have that kind of participation.
Absolutely, on all levels. It's amazing.
Thank you so much, Kathryn.
Thank you.
Thank you for tuning in to learn more about Kathryn Harada and the Total Joint Program at CMHS. For more information on all the services and specialties offered at Community Memorial Hospital Health System, visit CMHS Health and be sure to like and subscribe for more from your community health system. Thank you, Kathryn.
Thank you so much. It's
You're
nice
welcome.
being here.
My pleasure.